All right, welcome back to the big show. We got some big news and awareness for you. So Breast Cancer Awareness Month is right now in October. We want to make sure that you are informed about all the various ways that breast cancer can show itself and a variety of symptoms that are abnormal.
We also thought it's important to talk about the different screening methods so you get an idea of what might be best for you. So as we thrive with Twin Cities Live, Dr. Lisa Hamilton with Minnesota Oncology is joining us with information on both. Dr. Hamilton, thanks for being here.
Good to see you again.
Very important information. I think, you know, a lot of times people are talking about there wasn't any signs, but I would assume that you probably run into a lot of patients who, oh my gosh, they noticed something different in terms of the physical appearance or feeling of their breasts, and they were able to sound the alarm. What are some of the common things?
Yeah, so some of the common symptoms of breast cancer would be changes to the way the breast looks, so whether it's the contour and there's a divot or a defect, as well as changes in the skin, whether it's dimpling or redness, or sometimes even just thicker skin than normal. But like you kind of already mentioned, the biggest thing is that there's, for the majority of women diagnosed with breast cancer, no signs or symptoms.
Shoot.
That's crazy.
Which is why early screening and early recognition based on screening tests is so important.
Yeah.
So let's go back to some of the self-exam stuff. Like, let's say that you find a lump or something abnormal. When do you just pass it off as like, okay, that could be just something benign, or when is it sort of like, oh, I need to go see a doctor for this? Is it size? Is it painful? Like, is it always accompanied by the redness? Like, when should you go and see the doctor?
So first thing, anytime that you're concerned about something and need more answers, you should definitely go see your doctor, whether that's your primary care doctor or a women's health provider that can do an exam and either provide reassurance if it's just a normal finding, or send you for additional testing or for another consultation with a specialist. But usually it's the duration of the symptom. So if it's been lasting longer than a few days or isn't getting better, those are things that you would for sure want to talk to your doctor about. But again, women know their bodies best. So if something doesn't seem right, you really need to feel empowered to go and bring it up to your primary care doctor or other provider that you see in healthcare.
So I know that you all at Minnesota Oncology, obviously in the name, you're focusing on cancer. So is it a place where people go just for their regular screenings, or are you getting referrals from people once they've received a diagnosis?
So for Minnesota Oncology, we usually see patients after they've been diagnosed with cancer, and I do breast cancer surgery, and so a breast cancer surgeon is oftentimes the first doctor that a woman will meet with during her breast cancer journey. So we see a lot of that. But we also do manage screening for women who are at high risk for breast cancer or have a history of breast cancer, family history of breast cancer. So we do manage screening for kind of high risk patients. And patients usually get to us by a referral from their primary care provider.
That's good to know. I just know, like, the text chain between my girlfriends is like, oh my gosh, I went in for my mammogram, and then they called and said something was wrong, but then they were worried, but then they can't get me in for another 2 weeks, and it's like, there's a lot of panic that goes along with this when you're going through these screenings, and I wonder how women sort of advocate for themselves, and maybe it is just going, okay, I'm going to call Minnesota Oncology right away and try to get in there.
So you're 100% correct that anxiety, especially around waiting for results or waiting for follow-up tests, it can be excruciating for many
like
patients.
Debilitating.
Yeah. You know, you don't sleep, you don't eat, you're thinking about it all the time. It's hard to function at work and with your family and all of those things. So I think getting a team around you, and again, whether that's your primary care provider, whether that's Minnesota Oncology or another oncology group, to kind of support you around that is really important, because we've got lots of resources. Nurses, social workers, you know, genetic counselors if we need genetic testing. Dietitians, all of financial counselors, all kinds of resources for patients that, you know, you might fixate on one part of thing that's causing a lot of anxiety, but we can actually help with all the other things that are going on at the same time.
Yeah. So when you talk about resources and like, let's talk about like the screenings. Like I know like the most popular is mammograms, but we have evolved technologically so far. So what else can you look at, and like what's the best fit for the right situation? So full stop, mammograms are still the best screening tool that we have for breast cancer.
and that's for all women. We prefer 3D mammography when available, which in the Twin Cities Metro, it's widely available. Your insurance covers it. Some smaller community hospitals in other parts of the state may only have 2D mammograms, and that's okay, but we prefer 3D. This is mammograms even for women with dense breasts. It's still the best test because a lot of women know their breast density and all of these things. The question is, are you at high risk, and would you benefit from any additional imaging in addition to the mammogram?
Okay.
And so that's where things like MRI come in, or a newer modality is contrast-enhanced mammography. The downside to both MRI and contrast-enhanced mammography is that they require IVs because both of them do require different types of contrast.
Oh, the dye.
The dye.
Okay.
The dye, so you do need an IV. They're longer tests than just a mammogram. Contrast-enhanced mammography has slightly more radiation exposure than just a standard mammogram.
Okay.
But MRI has no radiation exposure, so that's a great option for supplemental screening for many women that are at high risk or have dense breasts.
Interesting. And do you work? You're working with patients to figure out what the best option is.
Especially for those high-risk women or moderate-risk women with dense breasts, figuring out what the best screening tools are in addition to the mammogram is an important conversation.
This is good to know. So once you're diagnosed, before we go, it really is, you mentioned, getting that team, because the worst thing I could imagine is just feeling like you're going at this alone, and how do you even navigate this system?
Yeah. The multidisciplinary team that is needed to treat most cancers, including breast cancer, is really the most important part of this journey, and having the support that you need. So, that whole team of physicians and other providers that help take care of you, when you're talking about a cancer diagnosis, surgery, chemotherapy, radiation, get second opinions,
Yeah.
right? And you really just, again, you know your body best. You need to feel heard and your concerns validated. And if it doesn't feel like the right fit is there. We just need to find the right team for you.
I think that's the thing I've been so impressed with as we've been talking to doctors from Minnesota Oncology for the past few months, is just like how much you promote the patient's feelings matter and they're valid, and that you're not trying to steamroll or gaslight anybody into like, just because I'm the MD, I know best. You certainly know a lot, but you're not living in that person's body. It's an impressive philosophy.
Yeah. Every patient has different circumstances, so they all come to their diagnosis from a different place, so we just try to meet them where they're at.
Oh, that's great.
Yeah.
Thank
All right.
you
Thanks
so
for empowering
much.
all of us.
Thank
We
you.
appreciate
Good
it.
stuff.
So to learn more about cancer treatments and providers, Minnesota Oncology is the Twin Cities' largest and only independent cancer care provider with more than 100 experts in 13 locations. You can learn more at twincitieslive.com. Don't go away.